your name?
My name is Scott.
Scott, alright, nice to meet you, Scott. Can you tell me what's been happening today so far?
Well, I was playing football, and on my way back to my car I felt a bit dizzy and didn't feel like walking, so I sat down.
Okay, so dizzy, are you feeling just dizzy or anything else? Are you feeling shaky?
Got a bit of a headache as well.
Right. Okay, a bit of a headache. So you said you were playing football. How long have you been playing football?
About a couple of hours.
A couple of hours, alright, cool. And when you were playing football, did anything unusual happen?
No.
No, you didn't take any hits to the head or anything like that?
Not today.
Not today? Alright, that's good. Have you taken any hits to the head in the last week?
No.
No, none at all. Alright, now, have you had your blood pressure taken before?
I have.
Alright, do you mind if I put this on your arm and just take your blood pressure?
You can.
That would be awesome. Thank you. So, headache. Now, if you were going to describe the pain for me, alright, just going to try and get that. How would you describe the pain? Is it like a dull, throbbing pain? Is it a sharp pain? Does it come in waves?
More dull throbbing.
Alright, you kind of went like this. Is it everywhere in your head?
Yeah, just no specific area.
Kind of like wearing a swimming cap right when it's really tight. Is it kind of that tight feeling?
Yeah.
Yeah? Alright, and if you were going to give it a rating from 1 to 10, with 10 being the worst pain you've ever felt in your life, what kind of number would you give it?
Maybe like a 5, 6? 5.5?
5 or a 6? Yeah, okay. And when did that headache start?
About an hour ago.
About an hour ago. Alright. Would you describe the pain as sudden or was it kind of slow and gradual?
Maybe slow and gradual.
Slow and
It
gradual.
just hit me. It was...
Yeah, it kind of built up and you noticed it. Yeah, okay. Alright. Now, my current working differential diagnosis here is that Scott may be suffering from either heat stroke or dehydration, so I'm going to investigate this line of query further. Alright, so you were playing football. Have you had anything to drink since you started playing?
No, not really.
No? Have you had anything to eat today?
No.
Alright, want to tell me about that? Why haven't you had anything to eat or drink today?
I woke up a bit late, and by a bit I mean a lot late.
A lot
so
late,
I had
right.
to rush out the door and get here as fast as possible, so I didn't have time.
Okay, that makes sense. Alright, not the best plan, mate, I must admit. Alright, now, just because you said you haven't had anything to eat, I'd like to take your blood sugar levels, if that's okay.
No.
Have you had that done before?
No.
No, okay, so I'm guessing since you haven't had it done before, you don't have diabetes.
No, I do not.
Alright, do you have any other medical conditions I should know about?
Not that I'm aware of.
No, not that you're aware of? Probably not. Generally healthy?
Yeah.
Occasional cold and flu, that kind of thing? Alright. Do you mind if you hold for a second? Alright, so what I'm going to do is I'm just going to stab this into your finger.
Cool.
Alright, and so that shot scratch. And this little guy here is like a blood version of Digimon. So he's going to take your blood sugar levels for me, okay?
Retro.
It is pretty retro. Alright, so your blood sugar level is a little low, mate. It's got 3.2. And combined with your blood pressure, which is a little on the low side as well, especially since you've been in sport, and I think you're a bit dehydrated.
Okay.
Yeah, so what we're going to do is I'm just going to do a couple more quick tests, but while I'm doing that, I'm going to get you to sip some water. And I'm also going to give you some really disgusting tasting pasty that will make you feel better, okay? It's just glucose, which is what your body needs, so...
Ooh, sugar.
Pretty much, yeah, but not nice sugar.
Yeah.
Gross sugar. Sorry. But if you can suck on that slowly for me while you drink your water, that'd be fabulous. And so you're wearing your sunglasses. Were you wearing those when you were playing?
No, it's a bit of more... The sun's a bit hurting my eyes, so I thought I'd put them on.
Okay, is it hurting your eyes or is it hurting your head?
Well, it's hurting my head, yeah.
It's hurting your head,
Through
yeah.
my eyes.
Okay, through your eyes. I understand. Just checking. Alright, so what I'm actually going to need to do, I'm going to be really mean. I'm going to make you take the sunglasses off for a minute. Sorry, I just need to have a look at your pupils and make sure that you haven't been hit in the head and forgotten about it, okay? Alright, he has even bilateral pupil dilation, so I'm not worried about any potential neurological damage at this point. When I took his BGL and his blood pressure earlier, I noticed that his skin is quite dry. It's a little warm, but I'm not concerned about a temperature, although I will take one to rule that out. This to me is indicative that in spite of the fact that he has good peripheral circulation, he is slightly dehydrated. 10 minutes since you had that glucose and water. How are you feeling now?
A little bit better. Dizziness is sort of gone and the headache's receding a little bit.
Yeah, so it's kind of dulling down. What number would you give that pain now for your headache?
Like a 4, 3?
Yeah, so 3 or 4?
Yeah.
Okay, alright. I might give you some paracetamol if that's alright, just to help get rid of the last bits of that headache. And you're not feeling dizzy or anything?
No, not really.
No, you feel like you can stand up now?
Yeah.
Yep, alright, cool. So what I'm going to do is I'm just going to do some paperwork for you to take home with you. If you feel sick later in the evening, or if you want to back, or you can pop down to an A&E and just take that paperwork with you. I'll be able to look up my notes later in the system. So I'll give you this paracetamol, get you to sit here for a few minutes and check some volume, and then send you off on the way.
Cool beans.
Cool. Alright. In order to formulate a working diagnosis for my patient Scott, I used various differentials in his vital signs, which I took on scene. So his blood pressure was 100 systolic over 80 diastolic, which is quite low. For someone of Scott's size, you would expect his blood pressure to be slightly higher, especially post 2 hours of exercise, as he stated he had done. The gap between his diastolic and systolic pressure was also quite narrow. This tends to be a sign of hypovolemia. This combined with his heart rate of 100, which is tachycardic, all indicate this. He was slightly warm to the touch, although no more than you'd expect post-exercise. However, his cap refill was 3 seconds and his peripheral circulation was good. He was well cyanozed. However, he wasn't damp or even slightly sweaty, which you would expect after 2 hours of exercise. So this clinical picture indicated to me that he was in fact dehydrated or mildly hypovolemic, if you want to use the clinical term for it. Due to his dizziness, I took his BGL, which was low. It was 3.2, indicating that he was mildly hypoglycemic. Now, this is not uncommon for people who exercise quite a lot, and given the fact that the patient had consumed no food previously, during, or after the exercise, this was quite expected, and I believed it would be easily resolvable with a small amount of glucose taken orally. If his BGL had been any lower, or his GCS score had been lower than 15, I would have called for backup from an ILS to give an IV line of glucagon, and possibly to push some fluids through that as well, just to save time and make it easier for the patient. However, because his GCS was high, I believed that taking water orally and glucose orally would be more beneficial for the patient's physiology. The other thing I checked, just because of his slight dizziness, was I just checked him briefly for any indications of a traumatic brain injury. I did a equilateral pupil test of his eyes, which were fine, and I also questioned him a little bit about what had happened during the last week in terms of had he taken any blows to the head, which he confirmed he hadn't. So the light sensitivity of his eyes and his headache was simply due to the hypovolemia, which after 10 minutes did in fact begin to resolve. He had lost all signs of dizziness. He had a very mild lingering headache and didn't feel fatigued anymore. So I believe my differential diagnosis leading to the conclusion that he had hypovolemia and hypoglycemia to a mild level was correct. This has been my pre-hospital clinic OSCE video. Thank you for watching, and a thank out to my partner Scott for agreeing to be my excellent patient. Take 2. So my differential working diagnosis for this patient was that he was experiencing mild hypovolemia and that mild hypovolemia. Try again.